Guests on Keel heard via Jack Spring Electric Keel Newsmaker Hotline. Dr. G.E. Ghali is the chancellor at LSU Health Shreveport. Doc, welcome back to Keel. Thank you for taking time today.
Good morning, guys. How are y'all?
Good. Doc, you were with the governor during his briefing yesterday, and you said the positivity rate of COVID-19 in Northwest Louisiana is unacceptable. Explain what you meant by that.
Well, we, as you know, through our two main testing labs here, have been following very, very closely really two major subsets. We've been following the nursing homes, and we've been managing the nursing homes, and we've been doing quite a bit of community testing as well. I'm very happy to report, as I did for the governor yesterday, that the rate of positivity in a majority of the nursing homes is stabilizing and becoming lower in the neighborhood of 3 to 5%, which is where we like it. We'd love to have 0, but 3 to 5%. On the other hand, in the community, particularly in the younger populations, we're seeing increasing numbers, upwards of 15% positivity. And remember, we like the positivity to be at minimum below 10% and actually below 5%.
What do you attribute it to?
Well, I attribute it to what I call coronavirus fatigue. Folks are just tired of it, and hell, we're all tired of it. I'm tired of it.
Mm-hmm.
My family's tired of it. But it's important to continue to try to do the social distancing, the wearing the mask, and things that actually, frankly, are the law right now. And that's really what's going to help. And I think that people are just getting tired, Aaron, and they're not wearing masks like they should, and they're coming in contact more frequently than they should with people that are not direct family members. And I think that's really what's contributing to this.
It's a cool noise.
Yeah, Doctor's a musician also. You still with us, by the way? I hope we didn't lose you. I hope that wasn't a noise that knocked you off the air or disconnected your phone. You still with us?
Oh, that's an old grandfather clock in my office. I'm sorry.
Cool.
Wow, it sounds really weird on the radio.
Let me ask you this. We've been doing this mask thing now for better than 2 weeks. We anticipated we would see improvement. We're not. So there's a lot of us who say, well, do the masks really work? We're not seeing what we thought we would.
Well, yeah, certainly the masks work. I mean, we've been wearing masks in the medical field for years and years and years. As a surgeon, as I said yesterday, I've been wearing a mask for 30 years. The important thing to remember is that the numbers could be much worse than they are now if we weren't wearing a mask. All it takes is, it's kind of like that deal where you do one good deed. You're lucky if someone knows about it. If you get one person that knows about it. If you do a bad deed, 100 people know about it. The reality is, if you wear a mask, you're going to protect people, but it's more protecting on a personal basis of who you come in contact with. And then once it doesn't spread, it doesn't spread. But when you don't wear a mask, you're passing it on to multiple people. And what ends up happening is if we didn't wear a mask, the numbers would be much higher than they are now. So wearing a mask, they're still higher than we like them because not everybody's wearing a mask. And that's the problem, because it's getting spread sort of in an insidious fashion. So if we could control that to a better extent, then I think that we have been. Now, no doubt, more people are wearing masks than were wearing it before. But the reality is mainly the older folks. I don't want to say older. I'm including myself in that category. Folks over the age of 50 plus seem to be more responsive to wearing the mask than the younger population. And it's the younger population that seems to be spreading it more often.
Dr. Ghali, when we're talking case numbers, is that really the most important thing, or is it hospitalizations and deaths, and what do those numbers look like?
Well, I think it's a combination of all of the above. If you look at North Louisiana, as I explained to the governor yesterday and reviewed for him, I didn't have to explain it; he understands it. The reality is that we've been somewhat protected in the north. I think we just don't have the population density that they do down in the south necessarily. As a result of that, our numbers are going up, but it's not like going from 1,000 patients in the hospital to 100,000. It's like we had at our peak at our 3 hospitals in North Louisiana. At the peak, around the 8th of April, we had 70 patients that were admitted, 70 patients, 20 of them having to be put on the ventilator in between here and Monroe. Now, that doesn't seem like a lot, but that is a lot specific to that disease. As of early this week, we were getting close to that number again. We were in the mid-50s, and we had dropped down to a low of 24 patients on the 13th of June. So if you look at that, we've gone up exponentially from the 13th of June all the way up to where we are today. As I mentioned yesterday, there's a couple of days, the last 2 or 3 days, we've seen a drop. We'll see what the numbers look like today. We don't have the exact numbers yet for today, but we need to see a trend over a week or two that it's going down, plateauing and going down. We have not seen that yet. We have as much COVID in Louisiana today as we had back in early April.
I'm going to ask you. This is going to be a question, and it's. I hope it doesn't require like a 2-minute answer. But early on, when we were talking about flattening the curve, we were also told that the purpose of flattening the curve was to not reduce the number of cases, but to extend the number of cases as to not overload hospitals, ICU units, etc. And the way I understood it was that the number of people eventually who would get coronavirus was sort of whatever that number was, it was the number that was going to be. And then sort of flatten the curve got changed into nobody should get sick. Is it possible that we really can't control the number of people that eventually are going to get this? Is this all just a long-term futile attempt to control nature?
Well, you're correct, and I would say the answer is yes and no, both. I hate to tell you that, but the reality is the purpose of flattening the curve was not to reduce the total net number of cases, but was to slow the progression of the disease into the number, how quickly you got to those number of patients, so that the hospital care systems were not overwhelmed. The only way to actually be able to reduce the total net number of patients that are going to get the disease is to have a vaccine and hope that some people that have never been exposed to it are vaccinated. You understand? So it's a combination of yes and no. So, and that's kind of where we are right now. And then again, I'm hopeful that there will be a vaccine somewhere between December and February, I hope.
Some students are going back to school next week, I believe, in DeSoto Parish, then others in a couple of weeks. Will students pass this to other students? Will they pass it to adults? How concerned are you about schools reopening?
I'm not concerned at all. I think that it's the right thing to do for many, many reasons. I don't want to waste time talking about all the reasons, because you can read about them, and the American Academy of Pediatrics and all the educational programs around the country have discussed it. But the reality is, yes, there's always a potential that they can pass it. But if they wear masks, and it's recommended, I believe, to grade 3 and above to wear masks, you could get them to wear it in kindergarten if you really start showing them how to do it at home, and it's not going to be a problem. But the reality is that the risk of transmission in the school, if they do what they have planned with consolidation of classes, where students stay in that group together the whole time, I think all of those are going to help. The hand washing, the sanitation, and all these different things that we're talking about, taking the temperature and doing stuff like that. I would say that if what is done has been described in Caddo Parish and Bossier Parish and other parishes around here, if that's done, the risk of catching it at school is going to be lower than the risk of catching catching it going to the grocery store, or certainly going out and in a group of people that aren't socially distancing and aren't wearing masks and aren't using proper hygiene.
Dr. G.E. Ghali, thank you so much for your time.
Great stuff, sir. Greatly appreciated. Thank you for your time.